January 9th, 2012, and another Trahant Reports. I'm Mark Trahant. This election ought to be about one issue, a referendum on health care reform. Republicans say it's about repealing Obamacare. Every candidate has pledged to repeal the law, as if presidents had such power, as a first act in office. But then what? What actions would follow to improve health care and dramatically lower the costs? Is there a conservative alternative? I sure don't see kicking young people off Medicare as the solution. That idea doesn't even drive health care delivery costs down. But the what next remains a tough question for President Obama and the Democrats as well. The Affordable Care Act was a baby step, a beginning, not an end. This single election question matters because the cost of health care is the federal deficit. We are paying far too much for an inefficient health care system when we have an aging population that is facing expensive medical care. Just think, if we solve this one problem, the rest of the budget is manageable. But if we fail to reach a national consensus, then the budget obligations to pay for existing problems are many times greater than our resources. The Congressional Budget Office puts it this way, quote, projected growth in an entitlement spending explains almost all of the projected growth in non-interest spending. And the two big government health care programs that largely drive that increase, Medicare and Medicaid, are responsible for 80% of the growth in spending over the next 25 years and 90% of the growth by 2080. And what drives that unsustainable growth? The CBO says two things: the aging of the population and the rapid growth of per capita health care costs. Remember, the number of those eligible for retirement, the baby boom generation, born between 1946 and 1964, continues to swell. The number of older Americans is going up from 13% to 20% by 2035, while the share of Americans aged 20 to 64 is falling from 60% to 55%. A smaller working population, a larger retired population. The military is a good example of this demographic riddle. Defense Secretary Robert Gates, in his last budget message to Congress, said, sharply rising healthcare costs are consuming an ever larger share of the department's budget, growing from $19 billion in 2001 to $52.5 billion in this request. Now, Gates argued for increased fees from working-age retirees, saying that the system is unsustainable. And he said, quote, if allowed to continue, the Defense Department runs the risk of the fate of other corporate and government bureaucracies that were ultimately crippled by personnel costs, in particular their retiree benefit packages. Now multiply the Pentagon's dilemma across government, or throughout the private sector. Then the scope of the problem is visible. Add to that landscape complexity those Americans who cannot afford health care insurance. Medical issues just don't vanish because someone doesn't have insurance. They just get more costly and show up on another line item in the budget. That's why I think a key part of reform is improving health care that's delivered via government agencies such as the Indian Health Service and the Veterans Administration. We also need to show how the health exchanges will work and get hard data about their effectiveness. The Kaiser Family Foundation reports that there is a wide bipartisan consensus about the idea of healthcare exchanges. The trick then is to build on that consensus and make those exchanges effective. So how do we Americans debate healthcare reform? We make sure that this is the single election issue for the 2012 cycle.